Right, warm greetings from Geneva, Switzerland. I'm Murda Sadki. I'm here with Charlotte and Boo. We're going to run through this briefing in order to leave time for questions. So first of all, in case you do not know the Geneva Learning Foundation, we're a Swiss nonprofit, and really our mission is to research, just find better ways to learn and lead. Now, Teach to Reach Connect is a centerpiece for TGLF's work. We started Teach to Reach around immunizations, but it's now expanded, as you're going to hear, to many other themes. So what is it exactly? It's a regular event for immunization and other primary healthcare professionals, and it's a key platform for TGLF. And today, the reason we've invited you is to invite you to become a Teach to Reach partner, whether you're part of a national Ministry of Health team, whether you're a country or regional partner, a global partner, or a civil society organization. Now, we've been privileged to have a number of awesome partners, including Gavi and UNICEF, that have served as anchor partners in the recent past. You can see a longer list here of some of the logos of the partners who've worked with or through Teach to Reach. This is Dr. Ephraim Lamango, Chief of Immunization at UNICEF, and this is what he told us why he wanted to partner with the Geneva Learning Foundation and specifically around Teach to Reach. We want to listen. Co-creation is important, and he said he believes this is the type of innovative approach that we need. Now, in response to Teach to Reach, we've seen ascendant participation. You can see that in March 2021, we had 2,604 participants. The last one shown here is in June is over 16,000. And then actually Teach to Reach 9 in October 2023 had over 17,000 participants. You can see some of the distribution here on the right-hand side. Now, who attends Teach to Reach? People on the front lines. What we mean is people who work in government as well as CSOs, mostly at the local levels in health facilities and districts, but there's also a large contingent from the national teams who attend. You can see some of the stats here about people work in remote rural areas with the urban poor, with displaced populations in places where there are armed conflicts. And we always emphasize this, is that Teach to Reach is not about the connections that participants make with the Geneva Learning Foundation. It's about the connections that they make with each other and with partners. Now, uniquely, we asked Kate O'Brien at WHO, she's the chief head of immunization there, as well as Ephraim T. Lamango, whose quote you saw earlier, said uniquely Teach to Reach provides a way to link health professionals together so that they can share experiences about what works. Now, alongside Kate and Ephraim, Tahir Abubakar, who works in Zamfara State, Nigeria, he said his experience of Teach to Reach is the following: our collective experiences and passion can transcend borders and overcome even the most formidable public health challenges. Now, the key theme, as you know, in Teach to Reach 10 is going to be about health impact for local communities on the front lines of climate change. This is a theme that we launched at Teach to Reach 9 last October. And this time we're going to be really deep diving into this topic and inviting partners who work specifically on these issues around the impacts of climate change on health to join, contribute, benefit, engage with Teach to Reach. Now, last July, we had the first event on this theme, and this was 4,700 health professionals who registered less than 2 weeks and who told us a number of things that convinced us at the Geneva Learning Foundation that this was an important theme that we needed to attend to. First of all, the relationship to the community, the people who responded are health workers and who see themselves as part of the family or as trusted friends. What are they seeing? What are they observing? What's changing in terms of climate and health? And what do they think of it? You can see here that when we ask them to assign a threat level, to what extent is climate change a threat to the health of the communities that you serve? Overwhelmingly, people assigned the highest threat levels. Now, if your organization works on climate and health, why should you partner with Teach to Reach? Well, first, you may wish to show your support to health staff on the front line of climate and health. Second, and I'm not sure if this is in the right order, but you have to listen and learn from Teach to Reach participants. And this can be through plenary sessions, through one-to-one networking, through Teach to Reach questions. You don't need at this stage to understand the details of it, but there are many, many different ways for you, for example, to share your organization's tools and opportunities. Now, there are many other themes, including neglected needs of women's health with a focus on female genital schistosomiasis. And of course, we continue to relay and help amplify the movement for immunization agenda. For example, leaders of this movement, immunization agenda, is the world strategy adopted by all of the member states of the World Health Organization in 2020. So we are supporting and tracking and helping leaders connect to each other. This is in the thousands on the global scale. You can see just a few of the case studies and you'll be hearing from leaders, from some of these leaders at Teach to Reach 10. To help make sense of how these different interlocking pieces, these different challenges and issues fit together, well, we have we worked with the community of health workers that we reach through Teach to Reach and other TGLF programs to elaborate a manifesto for global health, which we see as an open source document. Over 1,300 health workers have contributed in various ways. Now, for partners in addition to, can support the manifesto, can support a specific worker theme, or can support cross-cutting Teach to Reach functions that partners can support. So now we're at the 6-minute mark, and I'm going to tell you what happens before, during, and after Teach to Reach. So first of all, before Teach to Reach, we invite Teach to Reach participants to answer questions to share their experience. So what does that actually look like? This means that we receive literally hundreds and typically between 1,500 and 2,000 responses, experiences that are shared by Teach to Reach participants. We then publish this. Our Insights unit then compiles this massive sample around the specific questions and themes. You can see here the sample description for Teach to Reach 9 and shares it back with the community. This is key to all of Teach to Reach, is that everything, if we ask a question, if we ask you to share your experience, it is in order to share it with others so that other health professionals may benefit from the experience that you shared. And so we have quite stringent rules when we work with partners about what questions we can ask and how, in order to ensure that principle is respected. Now, in the coming weeks and months, we'll be building momentum through a set of different activities. International Women's Day is the nearest one. That's Friday. But there's also be an ongoing series on really highlighting stories and images from health workers themselves, telling their own stories in their own names as we move towards, for example, World Immunization Week. Now, shared experiences collected before Teach to Reach provide deep insights into the themes that are explored in each Teach to Reach. So as we build momentum for International Women's Day, for example, well, we asked 2 questions across the Teach to Reach network. And you can see on the left-hand side, it might be a little small, Dr. Faiza Rabbani, a public health specialist for the Ministry of Health in the Punjab in Pakistan, who says, empowered women empower women, who tells a beautiful story. And there are literally hundreds of stories like this that have been shared by women that we're now sharing back so they can share them back with each other. At Teach to Reach and in the build-up to Teach to Reach, you'll be hearing from women who deliver vaccines, a self-organized collective of women who work in immunization. And you'll be hearing again about women and men who are working to respond to the neglected needs of women's health. So that's a big focus, building on International Women's Day as we move towards Teach to Reach. Next is and this is a beautiful photo. This is from a photographer, Chris DeBode. He's the Geneva Learning Foundation's first fellow of photography. And he has offered to host a workshop with the Geneva Learning Foundation and with immunization and other healthcare workers from 44 countries will be coming together on the 18th of March. 80% of the participants are people that we can say they work on the front lines. They have been invited because they were contributors to the 2022 and 2023 immunization agenda movement's international photo exhibitions. If you don't know about those, you can find them on our YouTube website as well as on our Instagram feed. Now, in 2022 and 2023, over 2,000 photos were shared by immunization staff from all over the world for this workshop on the 18th of March, and partners are invited to observe and listen and learn also with Chris and the idea is really simple, is that people who are there every day are in a better position to take pictures, to document their own work to show the strengths of how you make vaccines work, or how the loss and damage of climate on health is already something that is real and tangible for participants from the countries that you see here, for example. Now, you may ask, what are Teach to Reach questions? I went very quickly in the run-up to Teach to Reach. Everyone who's registered is invited to share their experience. And the questions are specific. If you don't have the experience, you shouldn't be answering a specific Teach to Reach question. And this is a very important part, because this is the heart and soul of Teach to Reach that happens before, because it is peer learning. We recognize people who respond, not just as respondents or people answering a survey, but as contributors with a capital C. And we honor them before, during, and after Teach to Reach. Now, next is what happens at Teach to Reach. Well, this is where you really get to meet, network, and learn. So you have, of course, a conference and networking platform that you can already get your registration done there as soon as you register for Teach to Reach. And of course, we provide instructions for that to partners. But the core, and this time, while the live event is happening, well, it's the one-to-one networking sessions that are really at the heart and soul of the Teach to Reach live event itself. You click on the button and you meet someone new, or maybe you see someone that you've seen at previous Teach to Reaches. Now, we're well aware of the connectivity issues, which is why we offer, if your connectivity is insufficient or you cannot afford to participate in the live event, everything except the live networking, which you can't really record, is available through the podcast. So you can listen in an audio-only format, easy to download, low bandwidth. That's one of the solutions we found in order to enable people to participate. Now, what happens after Teach to Reach? Well, we ask participants to share their learning, insights, and reflections. And everything that is shared by participants is given back to the community through the Knowledge to Action Hub. So the Knowledge to Action Hub is really just a sort of multi-channel, as many different ways that we have of sharing back with Teach to Reach participants. We do that, and we help them also stay connected to each other. Now, here is the reason we're here, is really to tell you how your organization can become a Teach to Reach partner. So there are two options. First one is partner, and the other is sponsor. So the first question is, are you a partner or a sponsor? Now, partner is open to every type of organization. On one condition, you've been invited by the Geneva Learning Foundation, and that means if you respond to the invitation, you supply the information we're requesting, we'll feature you as a partner with your logo and the link to your website. And it's really the opportunity to engage with Teach to Reach participants in a dedicated workshop. If you're a sponsor, that means that you are contributing to the costs of Teach to Reach. And there we have 3 tiers of paid sponsorship. And this is how we keep Teach to Reach going. We're at the 10th edition, and it's really the wonderful sponsors that we've had who've helped cover the costs that enable us to continue offering this event for at no cost to health professionals from low and middle income countries. The opportunity for global partners is really to connect, to listen, to engage, to support women and men on the front line of service planning and delivery. For local organizations, so national or subnational, there are really unique opportunities to meet, network, and learn with health professionals from your country, but also from other countries. And then to share your organization's mission, activities, results with Teach to Reach participants, including global partners, in a workshop. So all local partners can submit proposals for workshops, and if your proposal is accepted, then you'll be able to host your own workshop within the Teach to Reach space. That will also be amplifying Teach to Reach. So here are the social media links for the Geneva Learning Foundation. And of course, for partners, we'll be working to amplify and feature really what partners are bringing to the event, as well as sponsors, but not only sponsors. We really want to support and help amplify every organization that is contributing in some way to Teach to Reach. Now, if you decide to become a Teach to Reach partner, if your proposal is accepted, a few things that we can tell you right away about the partners workshops: you can have a listening session, you can also present your latest or your best, basically your best stuff, or you can have an interactive dialogue. All three are possible. One important note is that there may be in terms of how many people come. It's true that the number of people who register for Teach to Reach is massive. That does not mean that you will get thousands of people attending your workshop. It depends. The workshops run concurrently with networking and plenary sessions. We cannot predict how many people you're going to get in your workshop, and really the responsibility is on your shoulders to promote your own session, but we'll of course help amplify and coordinate with partners to make sure that you are reaching the right target audience and having a successful event. So that's we're now at the 15-minute mark. Before we go to questions, I want to cover some of the partner case studies, just to give you a sense of what partners have been able to do through Teach to Reach. The first quote I want to share is from Violaine Mitchell. So she's the director of the immunization program strategy team. And this was at the very first Teach to Reach conference in January 2021. She said, the Geneva Learning Foundation is actually setting the pace for how we do things in the future. So now, first case study is from UNICEF, and UNICEF had some questions they wanted to ask people on the front line on identifying and reaching zero-dose children with vaccines in urban and peri-urban settings. So we asked a simple question during the plenary session. Can you share a success story, lesson learned, or challenge? Knowing that in the IA 2030 movement, so in the immunization community that is reached by the Geneva Learning Foundation, 42%, almost half of members work with the urban poor. So what we had both during the plenary, but also through the Teach to Reach questions before and after the event, were details of experiences shared by people who, for example, this is one of 7 questions I believe that were asked by UNICEF. It said, are there very detailed technical questions, and in some cases are able to get really remarkably in-depth experiences. But overall, we get a sense of what is happening out there from the dozens or hundreds of people who respond. And again, Dr. Ephraim Lomengo, Chief of Immunization at UNICEF, said that this is exactly the type of innovative approach that we need to overcome the complex challenges that we're facing in global health. Second case study is from Teach to Reach in a collaboration with Immunization Agenda Working Group 1 on primary healthcare. So this is all the international partners. And you can see here the quote, the feedback from Dr. Folake Olayinka, who is also the team lead for immunization at USAID. But here she spoke as a chair of the IA 2030 Working Group. And what we did, I hope this will be concrete enough so you can understand. So the working group had a new framework on immunization for primary healthcare, but decided to do things a little bit differently. So we actually had, alongside Teach to Reach, a special event in which we engaged with, as you can see the numbers, almost 5,000 health workers who registered from all levels of the health system. And then we followed up. Everyone received the framework, and 30 and 90 days after, we asked, so what have you done with the framework? Is it useful to you? How could we improve it? And we shared that feedback with the working group. What we learned is, yes, a lot of people who said, sorry, I haven't had time to use it. I've been too busy. But also some credible, specific narratives of actual use, including adaptation at the local levels. And this is a great example of how you can take global guidance and really through that Teach to Reach engagement, get feedback to improve the global guidance and also to have that two-way learning, two-way dialogue between people on the ground and people who are working to support them at the country, regional, and global levels. So those are the case studies for this briefing. Looking forward to your questions. And just to explain how we're structuring the sort of dialogue with partners, of course, we're happy to engage individually, but we're really going to be focusing on these coordination check-ins once a month, where we'll be covering, you can see each time the specific sort of priorities or urgencies in order to make sense of the for you as a partner to understand what's happening next, what you need to do, what you can ask us to do, and what you'll be receiving or what the benefits are as we progress towards Teach to Reach. So once again, thank you, and looking forward to the discussion.